Hi everyone, it's me, Jen. Today I am talking to you about cerebral palsy. What is cerebral palsy? Cerebral palsy, CP, is caused by birth injuries that affect the central nervous system and called static encephalopathy. Less than 1% of children are born with this type of injury. Almost half of the children affected by cerebral palsy develop hypertonia, excessive muscle tension, or spasticity, excessive muscle tension with increased tendon reflexes. This is usually caused by damage to the white matter of the brain. Other affected children can have mixed cerebral palsy, experiencing multiple symptoms with spastic components. Cerebral palsy can result in irreversible damage and dysfunction of the nervous system. Causes of cerebral palsy. Many cases of CP have unknown causes. The disorder occurs when there is abnormal development or damage to areas in the brain that control motor function. It occurs in approximately 3 out of every 1,000 live births. There are several types of injuries that can impair the nervous system, including head injuries, central nervous system infections, episodes that obstruct the oxygen flow to the brain, such as near-drowning experiences, cerebrovascular accidents like stroke, malnutrition, heavy metal ingestion. Symptoms of cerebral palsy. The following are the most common symptoms of CP. However, each child may experience symptoms differently. The child may have muscle weakness, poor motor control, or have shaking, also called spasticity, of the arms or legs. Muscle stiffness in the form of stiff legs or clenched fists may also be seen. Cerebral palsy is classified according to the kind of motor function the child may have, including the following. There are 3 ways that spasticity or excessive tightening of muscles can present itself in children suffering from cerebral palsy. Spastic diplegia, where the lower limbs are more involved than the upper. This typically affects premature children born before 32-week gestation. Spastic quadriplegia, where all 4 limbs are involved equally. This typically affects children born closer to term. Spastic hemiplegia, where only one side of the body is involved. This typically affects children who have a history of ventricular bleeding that reaches the brain tissues, causing injury. Children with CP may have additional problems, including the following: seizures, vision, hearing, or speech problems, learning disabilities and behavior problems, mental challenges, not gonna say the R word, respiratory problems, bowel and bladder problems, bone abnormalities including scoliosis, a lateral or sideways curvature and rotation of the backbones, giving the appearance that the person is leaning to one side. Babies with cerebral palsy are often slow to reach developmental milestones, such as learning to roll over, sit, crawl, or walk. They may also have certain reflexes present that normally disappear in early infancy. The symptoms of CP may resemble other conditions. Always consult your child's physician for a diagnosis. Treatment for cerebral palsy. Baclofen. Baclofen is a muscle relaxant. It can be absorbed into the bloodstream when taken orally or inserted directly into the cerebrospinal fluid (CSF). This method was recently approved by the FDA and is particularly effective because it delivers the drug directly to the target site in the spinal cord. To deliver Baclofen to the CSF, an access device must be implanted underneath the skin and the fat of the abdominal wall, requiring a 2-inch incision above the waistline. After the device is implanted, a needle is used to place a small flexible tube into the lower back spinal fluid column near the targeted muscles. A child is usually required to stay in the hospital for a few days to recover from the procedure and allow physicians to monitor their progress. The device itself is a small titanium disc, about 1 inch thick and 3 inches wide. It contains a refillable reservoir for the drug and computer chip that regulates the dose. An alarm sounds when the device needs to be refilled. The battery is low or the pump is not delivering the drug. The pump should be refilled and medication adjusted every 2 to 3 months. Therapeutic electrical stimulation, TES. TES is a typical type of electrical stimulation used at night while patients are sleeping. It increased blood flow to weaken muscles to allow the body to deliver more growth factors and nutrients to repair the damaged tissues. This process usually takes between 3 and 6 months. Children usually undergo physical therapy in conjunction with treatment to increase muscle strength. Selective dorsal rhizomy, or SDR. The SDR technique involves cutting some of the sensory nerve fibers that come from the muscles and enter the spinal cord. A 5 to 6 inch incision is made along the center of the lower back just above the waist in order to expose the nerves and locate the abnormal portions of the nerve fiber that need to be cut. This allows better balance in the spinal cord and reduces spasms, but does require a commitment to physical therapy following treatment. Well, I hope that has helped you understand more about cerebral palsy and why their speech may be slurred or why they may be tight up like this and stuff like that. I have friends with cerebral palsy and they are the best. Please don't forget to subscribe and comment down below on what else you want to learn from me. Bye. Thank you.